The essential points of care in the premature infant. Preterm infants are born before 37 weeks. They are at risk because their organ systems are immature and they lack the ability to function in an extrauterine environment. Preterm births are responsible for almost 2/3 of infant deaths. There are several different things we need to assess in a premature infant. The most important thing being respiratory distress. Some things that you would look for signs of respiratory distress are nasal flaring, grunting, central cyanosis, and retractions. Look for the presence of apnea, especially during feedings, and for hypothermia. In case these things happen, interventions would be monitor the pulse ox and provide supplemental oxygen as needed. Another thing to watch for is thermal instability. Premature infants lack the ability to maintain regular body temperatures. So immediately after birth, we should monitor the infant every 30 minutes until stable and then every 1 to 4. Some interventions would include providing skin-to-skin contact immediately after birth for stable infants. Also, we need to take measures to prevent excessive heat loss, such as extra clothing or blankets, or maybe even placing the infant under a warmer. And remember to only bathe after thermal stability has been maintained for 1 hour.
Another common problem in premature infants is hypoglycemia. It's important to monitor for signs and symptoms of hypoglycemia, such as poor feeding, vomiting, pale skin, or tremors. Monitor bedside glucose in infants with additional risk factors, such as a mother with diabetes, a prolonged labor, respiratory distress, or poor feeding. Any reading under 40 should require immediate intervention. Interventions include initiating early feedings of breast milk or formula, or providing intravenous dextrose as necessary. Jaundice is also commonly seen in premature infants. It's important to observe for jaundice within the first 24 hours of birth. It's also important to evaluate maternal fetal history for additional risk factors that may cause increased hemolysis and circulating levels of bilirubin. Interventions include monitoring bilirubin levels and light therapy. Examples of discharge requirements for a preterm infant include: can the baby maintain its body temperature in an open crib for at least 28 to 48 hours? Can the baby take all feedings by bottle or breast without supplemental tube feedings? And can the baby gain weight steadily? And those are the basic essential points of care for the premature infant.